Welcome to the Better Birth Podcast. I am Kathryn, the founder of Anja Health, and today we have an amazing guest with us, Leslie Flannery. She is a registered dietitian and certified lactation counselor from Dayton, Ohio, and today we are super excited to talk about really advocating for yourself through gestational diabetes and how you can help gestational diabetes if you are diagnosed with it and what to look out for, things like that, because it definitely aligns with cord blood banking and Anja Health overall. Where you also have to advocate for yourself immensely throughout your birth plan and with your physician. So super excited to chat, and thank you for being here.
Yeah, thank you for having me.
Awesome. Well, I know I gave a bit of a background, but I'd love to hear about your background in your words to add a little bit of color. So I'd love to know about what you do and how you got interested in gestational diabetes. And I know you don't practice as a lactation consultant anymore, but I'd love to know more about that experience and interest too.
Yeah, so I'm a mom of two. I have two boys, and so I know firsthand what it's like to be pregnant and how it's such a vulnerable time, I think, in a woman's life. I mean, it's exciting, but it's also scary, and you're not really sure what you should be doing and where to get the right, information and resources. And so that's where my passion really comes in. I've been a dietitian since 2013, whatever that is, like 9 years, I guess. And pretty much that entire time, with the exception of a few months where I worked in the hospital, I have worked exclusively with pregnant moms, pregnant and breastfeeding moms. And so, kind of like what you're saying, how your company is built to help women advocate for themselves. That's really where my passion comes into, because I didn't have gestational diabetes in my pregnancy. I think a lot of people think that I did because and that's why I'm so passionate about it. But honestly, I think my passion comes more from really helping women advocate for themselves. I feel like I'm a very passionate person about anyone that I think maybe has some like injustices or just like that population that is not being heard. And after working with pregnant women, I really quickly started to notice, wow, these women are kind of like just a number coming in and out of their doctor's office, and they're not getting the attention they need. They're definitely not getting nutrition advice. It's just here, take your prenatal. And so that's really where it comes in. And then going into gestational diabetes, where women are being told to eat restrictive diets and being judged based on maybe their appearance or their weight or blood sugar numbers, without ever like really digging in to listen to the person sitting in front of you instead of just making assumptions. So that's really where my passion comes in. And so I take like a non-biased approach. I want to provide blood sugar education in a neutral way, not any kind of judgmental way. I'm not the food police. I'm not here to yell at anybody for what they eat. In fact, I would rather someone be able to enjoy food in their pregnancy, because I've been pregnant. Pregnancy cravings are real. So I just want to help women meet their goals, whatever those goals might be.
Awesome. Cool. Well, when should an expecting parent look out for gestational diabetes, and how would you describe it, and what causes it?
Yeah, so gestational diabetes, I think there's a stigma around it because not a lot of people actually know what it is or what causes it. But really, gestational diabetes, the word gestation means in pregnancy. So it's diabetes in pregnancy. The placenta, once you form a placenta in pregnancy, it sends off hormones that cause us to be more insulin resistant.
Mhm.
So the placental hormones essentially are making blood sugars stay elevated longer than they should. That's pretty much it. Now, there are risk factors, but someone can get gestational diabetes with zero risk factors simply because you have a placenta. So generally, the screening is between 24 and 28 weeks. That's when kind of those hormones start to get stronger. As baby grows bigger, the placenta is sending off more hormones. But if you have any risk factors, specifically if you've had a gestational diabetes pregnancy before, or if you have like PCOS, or you already were like pre-diabetic going into pregnancy, they will test you usually earlier, end of the first trimester. somewhere between like 10 and 13 weeks. They usually do an early screening.
Mm.
If you pass that, they still test you later anyway. So, if you pass that one, you probably still have to take another glucose test towards, the third trimester.
Okay, awesome. Are there any early signs that you've generally seen people experience? Like I've read being really thirsty and things like that.
Yeah, excessive thirst is always a sign of higher blood sugars. If your blood sugars are high, then you might feel really tired and lethargic after eating. Specifically with the pregnancy, like if they're noticing that you have more fluid, like more amniotic fluid in your ultrasounds, or baby's measuring much further along than you actually are in the pregnancy. Say they're measuring at 28 weeks and you're only 24 weeks. That would indicate that maybe your blood sugars are a little bit higher than they should be.
Right. Okay. And is there any way to prevent gestational diabetes that you've seen?
Yeah, this is a great question. And honestly, I feel like it depends on the person and what their genetics are, what their risk factors are. So if someone has had a previous gestational diabetes pregnancy, say they have a parent that has type 2 diabetes, maybe they have some other stuff going on like PCOS, that person is going to have a much harder time trying to prevent gestational diabetes.
Right.
If it's just something quick, like, say I don't have any other risk factors, but I'm not really eating in a balanced way. If I just get that, managed a little bit better, then yeah, I think it can be prevented. So unfortunately, it probably just depends on the unique situation.
Okay, interesting. Yeah. So as someone that guides pregnant parents through nutrition and such, how do you try and shape the plan to be preventative for gestational diabetes? Or do you generally shape it for those who already have it?
Yeah, I've had just maybe like a handful of women that have joined my coaching program in the hopes of preventing it. And I I can think of 1 to 2 right now that actually were able to prevent it, and they were able
That's
to pass
awesome.
their glucose tolerance test. Yeah. Others joined early in hopes of just getting nutrition balanced, and then they still ended up having it. They had previous gestational diabetes pregnancies before. So again, sometimes it's just hard to prevent. But typically my clients already have it, and then they come to me, and I do a weekly food log review where I actually take a look at exactly what they're eating for all their meals and all their snacks. And then I look at their corresponding blood sugars, and that allows me to give them personalized feedback and advice on, you need to add some broccoli here for fiber, or you actually need more carbohydrate, or let's try a different bedtime snack. So I give them tools and resources, but also that like little touch of personalization within their own diet is really helpful.
Yeah. Okay. That's awesome. Well, super cool that you're able to prevent it through very careful eating. So definitely something interesting. So if you are diagnosed with gestational diabetes, then does it just go away as soon as you give birth, or when do you expect symptoms to sort of subside and you don't have to be as careful?
Yeah, so gestational diabetes, if you've been diagnosed, it's not like it's going to go away. So it can be
Yeah.
managed, but it's not going to go away. And typically blood sugars are harder to control. They get higher as the pregnancy progresses. So very rarely, I wouldn't say it's ever like cured or resolved totally. But when you do deliver the baby and then you deliver the placenta that's causing those blood sugars to be higher, that's when it fully resolves. And that's for true gestational diabetes. If you have prediabetes or type 2 diabetes, that wouldn't be the case. So once you deliver the placenta, blood sugars will get easier. But if you already had underlying blood sugar issues, then you probably still will after pregnancy.
Okay, awesome. And so how do you also navigate sort of like insulin intake and things like that for especially expecting parents that are already taking insulin? Do you also coach them through that experience? And how do you kind of guide people if they feel overwhelmed through having to take insulin due to gestational diabetes and things like that?
Yeah, insulin can be really scary. And honestly, I think a lot of women do reach out to me. And that's their main goal, is to stay off
Yeah.
of insulin, because for whatever reason, some it might mean like if they start insulin, they can't have a home birth, and some they're just afraid of needles, and others
Mm,
just would rather not have to take medication. So everyone has a different kind of goal as of why they don't want to take insulin. But I will tell you, it is something that once women start it and they see that it does help lower their blood sugars, a lot of clients have told me, I was so stressed to take it. I started taking it and I actually feel better now that my fasting
mm,
blood sugar is lower because of the insulin. So, I think everyone's reasoning and experience is different, but I don't manage their insulin. So that
mm,
always comes from their physician. They're the
right.
ones telling them to up their insulin or lower their insulin or when to take it, and they prescribe it. What I will do though is on that food log, when I review the client's food log, and they'll tell me like when they're taking it, or I can see how much food they're having with their insulin. Sometimes I can
Mhm.
give them tips and tricks that integrates insulin, but I don't like ever manage it or give them special directives about their insulin.
Right. Okay. So is it possible to have gestational diabetes and not be on insulin?
Yeah, absolutely. Yeah, so you can be completely diet controlled, just meaning that your diet has got your blood sugars to where they need to be, so you don't need any kind of medication. So yeah, there
Yeah.
are women that stay diet controlled, and then some women end up needing insulin.
Okay. Awesome. And so you mentioned you have some few tips and tricks. So wait, sorry, let me start that. You mentioned you have some tips and tricks to manage gestational diabetes while on insulin. What kind of tips are most common?
Yeah, I think with insulin, because we know insulin is what brings your blood sugar down. During gestational diabetes, the insulin that your body's producing isn't working quick enough. So you're now maybe having to take additional insulin. And I think the key thing there is making sure that you're eating enough, right? So if someone's on a low carb diet and they're not eating anything that turns into glucose, but then you take insulin, that can be dangerous. That can drop you too low. It's kind of a common misconception that I see. Once you start insulin, you don't need to know anything about nutrition. I'm going
Mm,
on insulin. I don't need any help anymore. I actually think once someone starts insulin, nutrition becomes really important, almost more important, because those two things work together. It's
right.
not like one or the other. They need to work together for ultimate blood sugar control.
Yeah, definitely. So I feel like a common misconception about diabetes is that you have to give up all sweets and can't eat a ton of sugar unless your blood sugar is really, really low. So how do you manage desserts and things like that if you have gestational diabetes?
Yeah, I also agree with you. I think a lot of people think that someone got gestational diabetes because they ate too much sugar, which is not the case. And then I think a lot of times moms are like, well, I definitely can't enjoy like any ice cream, or I can't enjoy
Mm.
a piece of cake at my baby shower. And I mean, how sad is that, right? I know I have
Yeah.
a sweet tooth, and I do not want to tell a pregnant woman she cannot have a sweet treat. So really, the thing with managing blood sugars and including sweet treats is just knowing how to portion
Mm,
that sweet treat and portioning that sugar, and also how you're pairing it. So like if you're having a lot of protein and fat and fiber to go along with a small cupcake, your blood sugars are going to be much more balanced than if you have like a really big piece of cake by itself, or a really big piece of
right.
cake and ice cream, and you don't have any other protein or anything with it. So
Mm.
yeah, it can be done. I would say all of my clients are enjoying sweet treats when they want them.
That's awesome.
Yeah.
If you have gestational diabetes, what would you say is a perfect day's diet?
Yeah, so that's probably hard to give you a specific on. So that's kind of the stuff that I do in my coaching program.
Mm,
But in general, I give guidelines for how many carbs to eat at meals and snacks, and that can be different for everyone. The main thing to know is you don't want to totally eliminate carbs. So
mm,
doing something like keto or a really low carb diet,
yeah.
It might get you a low blood sugar right after you're done with that meal, but what generally tends to happen later on is you don't have enough glucose for your body's basic functions and needs, that
Right.
your liver will start to dump out extra glucose. So it can kind of be more of like a roller coaster with your blood sugars.
Mhm.
And that's why eating consistent carb. So you want to eat consistently through the day and make sure there's carbohydrate through the day so that your blood sugars stay consistent all day long.
Okay, awesome. And if it is up and down, how does it make you feel?
Yeah, being up and down is not going to feel great, right? So, like a high blood sugar usually makes you feel, like you said, thirsty, tired. Some people can feel sweaty, usually just lack of energy.
Mm,
Low blood sugar will make you feel like shaky and dizzy, and almost like you're going to pass out. You just don't feel
mm,
great when it's going up and down all over the place.
right. Okay, interesting. So what kind of birth preferences do you typically see folks with gestational diabetes seeking, or what is necessary to think about during birth to have as a birth preference if you have gestational diabetes? And how do you help folks advocate for themselves through that?
Yeah, I mean, women are all so unique and our experiences are so unique that I can have two different clients and they want two totally different birthing experiences. So
Yeah.
I like to meet them again and just kind of being in a neutral standpoint. I don't want to ever tell someone what they have to do. I just want to know, what is your goal? Let's work towards that. So I do. I have quite a few women who want to have home births and home
Mm,
deliveries. And that's their main reason for joining, because if they start medication, they risk out of that
mm,
birth experience. And I think that's really, too bad. If they have a healthy pregnancy, that changes their whole delivery experience. So everyone's wants are different. I think what I really talk to my clients about is, if your doctor is telling you, okay, you have gestational diabetes, and for that reason alone, you're going to have to be induced early. I'm like, no, hold up. That's not true.
yeah.
So I just want to give them the facts and give them research, you know, based science that says, okay, the research says that gestational diabetic moms can go up to 39 weeks and 6 days, which is
Mm,
about 40 weeks, right? It's like one day shy of 40 weeks. So if your blood sugars are in control, your baby is growing on, they're not too big, or too small. They're proportionate and they look great on the ultrasound. Your fluid levels are good. You don't have glucose in your urine. Blood pressure is
mm,
good. Like nothing looks, you know, scary. Nothing looks like
yeah.
this baby needs to come out. Why can't you give me more time? Why can't maybe I come in and you check me a few extra days of that 39th week instead of being induced, like just to
Mm,
make you feel better and to make me feel better? Can I just be checked a little bit more often? You know, I think doulas are amazing people. I'm not a doula,
yeah.
but I think just knowing your rights and asking questions to the provider. I just really want moms to be able to have the experience that they want to have as much as possible with this diagnosis. So if we're saying early induction or C-section for no reason, then I'm like, okay, well, you can push back on that. Or if you don't
Yeah.
like your provider, you can find another one. So really just
Mm,
trying to help them make sense of it all, I guess.
right. Right. So you mentioned that they have, or the gestational diabetic pregnancy can last to 39 weeks and 6 days. So if they hit the 39th week and you have gestational diabetes, you have to be induced at that point.
So the research says they are allowed to go up to 39 and 6.
Yeah.
But a lot of doctors will tell them 38-week induction, right
Mm,
at 39-week induction. So again, I think that goes back to, like, if baby is measuring a lot bigger, your blood sugars, like your fasting especially, won't come down, things don't look super well managed, then maybe the induction is the route to go. But I also want women to know, ultimately it's your decision. You don't
yeah.
have to do anything that they're telling you, but you should know the risk of saying no to something. It's really just knowing, like, What does the research say? What's a risk of not doing that? What's a benefit of not doing that? What other options do I have? And just, really being a part of their healthcare team. They're
Yeah.
paying for that service. I feel like they should have a voice. It is their birth.
Yeah, definitely. I think a lot of my followers who are pregnant, they talk about how they are scared to approach their physician about their preferences. So, how do you help folks navigate any fear that they may have, even if their doctor is nice?
Yeah, I think I'm a good sounding board. So, right, like gestational diabetes, from what I hear people say, it can feel very isolating. Like
Mhm.
there's some shame that comes with it. There's a stigma that comes with it. So these women aren't probably talking a lot about it to their friends and family. Some of my clients are like, I don't even tell anybody that I have it.
Mm,
That's how much shame it can bring them. So just having me as like a safe space and the program itself, so the moms can talk to each other, and know that they're not alone in this journey. I think it can give them more courage and like a leg to stand on.
mm.
Like, oh, wait, I see the other side of this. Okay, well, I am going to ask my doctor about that. So I think it does. It gives them a little bit more empowerment to like go into
Yeah.
their doctor and say, well, wait a minute, ultrasounds are not 100% accurate. Can we like wait or.
Yeah, yeah, for sure. Okay, awesome. So if you had three tips to give someone with gestational diabetes, what would they be?
Ooh, that's a good one. Okay, so number one tip across the board, do not eliminate your carbohydrates. You need those. You're growing a baby, your body needs carbohydrates, so don't go super low carb. My second tip would be to get some exercise, get some movement in. It doesn't have to be intense or aggressive. I think, 10-minute walk after you eat, it really can help lower your
Mm,
post-meal numbers. So that would be my second tip. And my third tip would be kind to yourself. Like have some grace with yourself. You don't have to be perfect. There's a lot of pressure put on you with gestational diabetes. Just know that you're doing your best.
yeah. Okay, amazing. Cool. Well, I'd love to pivot towards your career as lactation counselor. So although you don't practice anymore, what got you interested in that? And yeah, what were your tips there and how did your practice work and things like that?
Yeah. So breastfeeding is something I didn't see growing up. My mom maybe breastfed me like a month or two. I don't have siblings, so I didn't see that happening. And they say like the women that are most successful with breastfeeding are typically ones who have seen that modeled for them. So
Mm,
they've seen moms and grandmas and aunts and friends and cousins breastfeed their kids. I didn't see it really at all.
yeah, I didn't
Um,
either really. I was a brother, but he was I was 2 when he was born. So I don't remember it either.
yeah. Yeah, I think I had one aunt who breastfed, and I mean, I do remember it, but
Yeah.
it was hard for me. So with my first baby, I wasn't certified as a lactation counselor, and I knew zero about breastfeeding. I knew I wanted to do it, and nutrition was important to me, but I didn't really know anything about it. And then fast forward to my second son, I was pregnant when I was being trained on breastfeeding and working with postpartum moms. And I really was like, oh my gosh, women just don't have the facts. They don't
Mhm.
have the information. And so it became, again, I guess I'm just really passionate about education. I want a mom to know all of the facts up front. And then with those facts, she can make the best decision for herself. It might be to not breastfeed, but I want her to know what all of this means so she can make the decision, because I had heard so many postpartum moms say, well, I quit breastfeeding because my doctor told me this. That wasn't true.
Mhm.
Or, I thought I didn't have enough milk, but really it was like a latch issue or it hurt. And it's just like things that I wish they would have known before
Mm,
they even had the baby. So yeah, I think really educating women when they're pregnant about breastfeeding is very important. Um, yeah, I just have such a big heart for breastfeeding because I think it's such a cool thing that we can do.
Right.
So yeah.
Yeah, that's awesome. Yeah, I feel like something that I hear a lot just chatting with pregnant parents is that there's a lot of surprising shame around a lot of different aspects of breastfeeding that's not discussed, like even shame when your milk supply starts to lower, or shame when,
Mhm.
yeah, like you can't get your latch correctly, or shame around using formula too early and things like
Mhm.
that. So yeah, I feel like lactation consultants are a super underestimated part of the birth and postpartum experience.
Yeah, for sure. I agree.
Um,
I think there's just not much, like after a woman has her baby, it's like, oh, we're done, like moving on.
yeah,
We don't do a lot in this country anyway for postpartum moms, which
right,
is too
right.
bad.
Yeah. So if someone is currently pregnant, what kind of tips would you give them to prepare for breastfeeding and just prepare their body? Like I know I've heard things about being able to pump colostrum and things of that nature.
Yeah, I think so. Going to my gestational diabetic clientele, harvesting colostrum, so like pumping some colostrum out. Usually they store it in syringes.
Mhm.
Starting, I think, at like 36, 37 weeks, definitely check with your doctor, on what they would recommend. But because nipple stimulation can,
Right.
induce labor. So you don't want to do it too soon, but it's really important for that specific population because babies that are born to gestational diabetic moms have a higher risk of having low blood sugar at delivery. And so the way to treat low blood sugar is to feed them. And so a lot of moms would rather feed their baby with their own pumped colostrum than use formula. Not that formula is wrong, but colostrum is liquid gold. It is so special. It has so many good antibodies, and just it's so great to get the baby's immune system started and get it going. So I would say if you're able to get some colostrum out, and it might just be hand expression because colostrum versus your like mature white milk that we think of, colostrum's really thick. So if
Mm.
you use like a regular, electric pump, you might not see a lot of it come out. Sometimes moms who have just delivered try to do that and they get worried, like, oh my gosh, I don't have any milk. But truth be told, the colostrum is just so thick that it doesn't come out really well. So
Mm.
probably just hand expressing some of it is a better option. Um, I think skin to skin is amazing and it should be done all of the time when it's available or when baby is healthy enough to do it. So putting baby right on your chest, your bare chest, bare baby right after delivery is a great way to get breastfeeding going. And then I think, like you said, checking in with a lactation consultant, not just in the hospital, but even when you go home, because breastfeeding in that newborn phase, it can change in an instant. Baby could be latching great at the hospital and then you get home and all of a sudden it's like hurting a lot. So just
Mm.
just getting that correct latch can make a world of difference. And it's something
Right.
that's usually pretty easily fixed if you're working with a lactation
Right.
counselor.
Yeah, I recently saw this video where a lactation counselor was massaging the baby's mouth and getting their tongue to be used more rather than sucking so intensely. So I thought that that was interesting because I feel like normally people think of latch as just the position in which your baby
Yeah.
comes, but like even things like massaging the baby's mouth can just sort of get them in tune with what they should be doing that could make for a more efficient process.
Yeah. And I think too, like we're so hard on ourselves as women and brand new moms. We want to get it all right because of course there is that judgment. But just remember that you're both learning something new.
Mm.
The baby's learning
Yeah.
how to do all of this. And like you said, it might have a tight grip, and mom's learning how to get the baby on there and get latched while also being sleep deprived and stressed
Yeah.
out and hungry and thirsty. So, giving yourself tons of grace and being nice to yourself in those early breastfeeding weeks is so important.
Right. Okay, awesome. So we chatted about breastfeeding prior to birth, but after birth, what is sort of your go-to tip for moms that are breastfeeding?
Yeah, I think the skin to skin would be my biggest tip. And they're even letting moms who have just had C-sections, they're
Mm,
trying to get that to happen more often
right.
for moms who have just delivered via C-section too. But that skin to skin is so important because baby can hear your heartbeat. And that's what they've heard for the last 9 or 10 months inside your
Mm,
stomach is your heartbeat. So it makes them feel safe. And they say like the scent that comes off your mammary glands is the same scent of amniotic fluid. So
mm,
it feels like home and it feels safe to them.
yeah.
Plus, they're in the exact right spot to breastfeed. And if you haven't ever, or if anybody that's listening has never Googled the breast crawl, you should
Mm.
totally look it up because babies like innately know what to do and they kind of like will find the nipple and start nursing on their own. It's so cool.
Yeah, that's awesome.
Yeah.
Um, okay, cool. Well, if you have just any tip on how to have a better birth, what would it be?
Oh, yeah. I think, I did not use a doula in either of my pregnancies, but looking back, I wish that I would have had a doula because I think those
Mm,
women are so important and special in helping you advocate, especially in the delivery room. When you might be in a contraction, you might not be feeling well, and you kind of forget the things that you wanted. They will know what your goals are. They'll know, like, okay, she does not want Pitocin, or she does want this for sure, or she doesn't want
hmm.
that. They really help communicate between you and the doctor of what your needs are. So I would highly, highly recommend a doula. But I think just that advocating for yourself. Don't hesitate to speak out because you don't get this experience back. It's your birth experience. Doctors do this hundreds of times a week,
Yeah,
but this is your one time. So make sure that it's what you want.
right, right. Okay. Yeah, definitely a great tip. At Anja Health, we have a bunch of doula relationships we've been facilitating, and our head of community is a certified doula too. So it's super interesting to talk, even with Amelia, the doula on our team, about yeah, just her birth experience and also all the births that she's seen and the wide variety. And yeah, it's definitely a big advocacy piece. Well, I'd love to have any listeners be able to connect with you and reach out and definitely take advantage of your offerings and coaching practice and everything like that. So, if anyone does want to reach out, where can they find you and your practice?
Yeah, I am in the midst of building a website, so that's coming soon. But you can find me on Instagram at Gestational Diabetes Nutrition. I have the link in my bio there for my coaching application. And in that, you get personalized feedback, you get sample meal plans,
Mm,
blood sugar friendly recipes, and just day to day support for anything that you need. So, yeah, that's where you can find me.
okay, amazing.